Good afternoon, everyone. My free paper is on assessing the efficacy of online vision therapy, revital vision in amblyopia. No financial interest in the study. As we all know, amblyopia is a neurodevelopmental disorder of vision resulting from poor visual stimulation during early childhood, leading to reduced visual acuity in one or both eyes. It affects almost 3% of the population. The conventional and the gold standard treatment include depriving the better eye with either patching or the atropine penalization. But what are the challenges we face? Because of the poor compliance and poor cooperation in younger children and its poor efficacy in age more than 18 years. So is this mission impossible? This is what we are dealing here in our study, revital vision therapy. It's a FDA approved clinically proven therapy for adult amblyopia and children more than 9 years. It's based on the principles of perceptual learning and neuroplasticity, where repeated visual stimulus are given in the form of Gabber patches, which is a gray and white striped patches, which as a size and shape matches with the receptive field of the neurons in the primary visual cortex. So repeated stimulus with the GABA patches helps in neuronal efficiency in the primary visual cortex, utilizing the principles of neuroplasticity. So it is non-invasive, home-based, no need to patch or disrupt the daily routine, and clinically proven for adult amblyopia. So our aim is to assess the efficacy of online perceptual learning therapy in improving visual outcome across different age group and different severity levels of amblyopia. It was done retrospectively from the period 2020 to 2024. There were 16 patients included in the age from 8 to 35 years with the diagnosis of amblyopia. The main inclusion criteria were age should be more than 8 years, better eye vision should be better than logmar 1, strabismus angle should be less than 8% diopter, and they should have a accessible computer mount of 15 to 26 inch. And these are the other criteria. And it was administered in a controlled home environment with around 40 to 80 sessions, each session lasting 30 minutes, and around 3 to 4 sessions has to be done in a week. And the first trial is done at the clinic, and the result is automatically sent to the data center that they will form a customized approach to each individual. Thus, each treatment directly treat the neuronal inefficiencies, and the progress is analyzed at 20 session, 40 session, and 80 session based on BCVA and stereopsis. And the end point is when the patient does not improve beyond 40 to 80 sessions. All patients underwent a complete comprehensive ophthalmic evaluation, mainly looking into the pretest visual acuity in logmar and stereopsis in Randall stereo acuity chart. And all were given monocular training, and it was completed over 2 to 3 months. Post-test also, we looked into the visual acuity and stereopsis. We also did a subgroup analysis based on the number of sessions attended and between the age group and types of the amblyopia. Coming to the result, most of our patients were in the age group of 20 to 30 years and male outnumbered in our study. And majority had a moderate amblyopia based on the petit grade. And among the types of amblyopia, refractive amblyopia predominated. And the number of sessions, most 57% could attend at least 40 to 80 sessions, and most of them had a unilateral amblyopia. Coming to the pre and post session BCVA, pre-session, 44% had a visual acuity between 612 to 636. Post session, it improved to 50% had 66 to 612. It shows a statistically significant improvement in BCVA, around 1.5 line in improvement in BCVA we noted in our study. Change in stereopsis from pre-test to post-test also show a statistically significant improvement in stereopsis. Subgroup analysis based on age also, so there was a statistically significant improvement between the age and also between the number of sessions attended. And based on the type and severity of amblyopia, we found that there was moderate amblyopia showed significant improvement. And between the types of amblyopia, the change was not significant. However, they had a large refractive group had a largest mean change in BCVA. Based on the subgroup analysis in stereopsis, between the ages and between the number of sessions attended, there was no, the changes was comparable. And based on the type and severity of amblyopia, stereopsis improved significantly in moderate amblyopia, and stereopsis improvement were comparable between the types of amblyopia, though the change was not statistically significant. 4 patients in our study did not show improvement in distance visual acuity. However, all of them had a significant improvement in near stereopsis. Coming to the discussion, significant improvement in BCVA by 1.5 Nile in Snell and not in all age group, and moderate amblyopia and refractive amblyopia had a better response. And improvement in stereopsis also was statistically significant at the end of the treatment session, with moderate amblyopia had a better response and it was comparable across the types of amblyopia. To conclude, Revital Vision, it demonstrates statistically significant and clinically meaningful improvement in BCVA and stereopsis in amblyopia across age and severity spectra. It shows a paradigm shift in vision rehabilitation in adult amblyopia and older children. So this study add a hope for adult amblyopia where practice make perfect and permanent. Our brains are plastic and we have the ability to shape them throughout our lives. So it utilizes the principles of neuroplasticity in adult amblyopia. These are my references.
Hi, Dr. Namitha. Excellent presentation. Which pathway are you thinking that it's stimulating in this particular treatment?
In the
Which one? Parvocellular. Which one? Parvocellular. Which pathway is it stimulating?
it mainly
In
based
depth.
on magnocellular pathway.
Magnocellular pathway. Okay. Has no role in parvo or conio. Nothing. Only magnocellular. Thank you.
Therapy will be for how long we have to give? 2 to 3 months. And we have to repeat this therapy, or after one therapy it will be patient will able to.
Total 40 to 80 sessions, sir. So the effect is lasting for a year. So the follow-up is still going on.
Okay. We have to see again. It means.
Till now there is no rebound of amblyopia what we are seeing.
No, did you try to compare it with the other types of amblyopia therapy management? Nowadays we have Binox and majority else have come. Otherwise, it's very difficult because it's a single arm study.
Yes, sir. Binox, we recently only introduced in our center. So
Okay.
I mean our study counts and all yet to come.
Okay.
Yes,
So
we can.
if the comparative study could have been done with the other modalities, then we could have try to relate that which is more superior as compared to this. But this is showing improvement of 1.5. So gold standard patching method, do you think will not give you 1.5 if you compare it with the
Sir,
gold
this is-
standard?
Yeah, this is mainly looking at the adult amblyopia.
Adult
who are
only I'm
not-
asking.
yeah,
In adult,
patching definitely no.
no, it will not help at all. The gold standard, because recently we were having a session in IIRSI where Dr. Pradeep Sharma still constituted that the patching, there's nothing replaceable. Of course, many new fancy items have come, many new fancy machines have come. That is magnocellular, what's that? S cell stimulator, all those things have come. So I just wanted to ask your opinion about all these, the new things, according to you, which one works better?
Definitely patching beyond the age of 18,
It will
I
not
really
help.
think it might not work. But still, if the patient can't afford all this therapy, then the other option is patching only.
Okay.
This comes around 50K, ma'am. They have to purchase the license and then they can do it at home.
So the maximum they got was 1.5 lines, is it, or beyond that also? That was the
In
minimum.
our study, but the literature, it was around 2.5 lines.
2.5 lines. Good.